Thanks, Joy. I'm Alison Holloway. I'm a UK dietitian and I work primarily with people who are neurodivergent and have chronic illnesses like MCAS, POTS and EDS.
Hi, I'm Chloe. I am a dietitian. I've specialised in gastro conditions for a long time. I now mainly specialise in MCAS and histamine issues. My husband has MCAS, which led me to support many people with the condition.
Okay, and I'm starting with the questions, aren't I? So question one, which I think is one of the new questions, is from someone who's put themselves on a low histamine diet and it seems to be helping them a lot, but they're vegetarian and are struggling for protein ideas. All the things they used to love are high histamine, like nuts, tofu, beans, and dairy. I've tried to reintroduce some of these, but get a reaction. So the diet's very heavy in carbs, and they're always hungry. Oh, we do not want to be hungry all the time, do we? That's
No,
miserable.
rubbish. And I think it's really, really hard to be on a vegetarian diet or a vegan diet and on a low histamine diet. Um, I'm always so excited when people come to see me and they think that things like nuts and beans and pulses and seeds and tofu are high histamine because they are not. So when we've looked at the studies, actually all these things are low histamine. The only one that you might want to be careful is if you're sensitive to histamine is pistachios. Um, Obviously, if you're still reacting to them, as we know with MCAS, you can react to many things that aren't just histamine related. So if you are still sensitive to those foods despite being low histamine, I think it's really, really important with those dietary restrictions to work with a dietitian experienced in this area because your diet can become really restricted and you can end up really malnourished.
Yeah.
Um, but there are protein powders as well you can use that are low histamine. So things like brown rice protein powder is one I commonly use, or hemp powder or spirulina. So there are things where you can add protein to your diet if you think you're not getting enough because of the dietary restrictions. Anything to
Yeah.
add, Alison?
Yeah, I was just thinking about the dairy products as well, because this person's vegetarian rather than vegan. So there are, dairy is not a high histamine. Some dairy foods are, aged cheeses and things like that, but there's no reason not to have other forms of dairy there. Um, I suppose what they're saying is that they've tried to reintroduce some of those, but are still getting a reaction. It's likely then to probably be something else, and we need to be looking, is there something else in the food that that person's reacting to, or is it not food at all, and it's something else they're reacting to as well.
Yeah, and I think if the diet has become that restrictive, I think we need to look at other things that can help. So, like you say, are there other triggers? Is stress massive? Are they on all of the medications? Have they tried medications? I think if it's become that restrictive and you really can't tolerate these foods, that's when you need to be looking at can you get medical support to really try and expand the
Yeah,
diet a bit.
yeah, because we want people to be as least restrictive as possible, don't we?
Yeah.
And if you've already got kind of a diet that limits you in some way, and being vegetarian or vegan limits the selection of foods that you can have, then adding extra restrictions on top of that is risky.
Yeah.
Um,
Yeah. Um, and the next question is, um, my questions are regarding histamine liberators. How do they work? And is this why people might react to chocolate and orange juice as they don't actually have histamine content? Um, and then there's a part two to the question we can answer afterwards.
yeah, so this is really about histamine liberators, isn't it? And there isn't really any evidence, is there, in human studies for the effect of histamine liberators actually liberating histamine in humans. Um, So it's one of the things that gets me because then people end up with a big list of extra foods to avoid, which, they might not need to avoid at all. And I think the reason that some things, maybe like chocolate and orange juice, are included in lists is not necessarily only because of histamine liberation, but maybe because they've got other food chemicals or other amines in them, other than histamine. And that's why they've been included in those lists. I don't know if that's kind of what your take on that as well, Chloe.
Yeah, absolutely. That's the only reason they're in the list. So actually, when we did the histamine sheet for the BDA chocolate's actually really surprisingly low in histamine, and it's
Yeah.
a one that so many people say they react to. Um, but it is the other amines, and basically they fill up the enzyme that helps us break down histamine, leaving no room for then histamine to be broken down. So that is why some people react. But the histamine liberator stuff is all in test tubes. And as we know, we don't work like test tubes.
Definitely not. Um, I'm just looking what the other bit was. Any difference between mast cell activation syndrome and histamine intolerance? Well, yes. So histamine tolerance is intolerance of histamine, and mast cell activation, is the release of mast cell mediators, which include histamine, but also can include other things like prostaglandins, cytokines, and other sort of mast cell mediators. So they're not the same thing, but you can have both.
Yeah, and I
But
think that histamine intolerance, usually you just have an issue with histamine. With
yeah,
MCAS, often people have issues with many other different food chemicals or, environmental things that um, you wouldn't necessarily have with histamine intolerance.
yeah. Some people start off looking at histamine, don't they, and then realize actually they're reacting to a lot more things. It's not a bad place to start, because you can limit it to one thing, and if that improves things, fantastic. But it's not often that easy, is it? I don't think in practice,
No.
at all. Um, okay, so the next one then. I've been given a diagnosis of MCAS and struggling to find which supplements work best. I'm trying to avoid ascorbic acid, so vitamin C, because of corn fermentation. I've tried other supplements and which have small amounts of different sources of vitamin C, so things like rosehip, and got chest pains and tightness. Are there any MCAS recommendations for vitamin C supplements?
So, I mean, in terms of corn fermentation, it's something I have heard quite a bit. I haven't actually ever managed to find evidence that that is necessarily an issue in terms of vitamin C supplements. And for some people with MCAS, they tolerate them absolutely fine. Um, I think if probably the thing I would be encouraging if they're sensitive to supplements is maybe a filler-free supplement, and there's several companies out there that do them. So things like pure encapsulations, for example. But I think obviously the only way of knowing is trying it, and that's really, really tough, isn't it? Because actually you may get a reaction, and there's no way around
Yeah,
it if this supplement is definitely going to be safe for you.
yeah, and I think there's a lot of kind of bad press about corn and corn fermentation, and it goes back to, does it affect you as an individual, and have you kind of verified that by testing it? Because again, it's down to not avoiding things because of reading something, but avoiding it because it does actually cause a problem for you. There are quite a few vitamin C supplements out there that are not made by corn fermentation, so they're I'd say the ones that call themselves more natural. I hate that word because it doesn't mean a lot, really, does it? In reality, there's some really bad things that are natural, um, but that are made from things like blackcurrant, for example, rather than being fermented from corn. So there are supplements out there, and it probably is going to be trial and error to find one that suits you. Because even if we get a corn-free one, um, there is no guarantee it's going to be right for that individual, I think. Difficult, isn't
Um,
it?
and the next question was, is glutathione recommended for those who struggle with vitamin C and oxalate issues?
Now, this is a
Would
tricky one because there's not much information about this out there. And I think the problem is that glutathione supplements are not well utilized by the body. So that would be one thing I'd be thinking about in that. Um,
And I think the trouble is there's hardly any evidence for oxalate issues, and it's something that is talked about all the time online, but actually we don't really have anything to go on.
no.
Um, there's no single one like low oxalate list. There's no real guidance for dietitians to support people with oxalate issues. Um, so it's really, difficult, and sometimes people do seem sensitive to oxalate. Sometimes I think it's just food generally. You're just reacting to everything because things like mast cells are on such high alert. So, but in terms of supplements and oxalates, we have even less evidence for that.
Yeah, I mean, there's some evidence. Well, even that's a little bit grey, isn't it, to do with kidney stones and oxalates? Even that's a little bit debatable. Um, but and vitamin C in causing that because of vitamin C coming out in urine. Yeah, it's a very unclear picture, and I think it goes straight back again, which will be repeating ourselves a lot. I think of what's working for you as an individual or not working for you as an individual
Yeah.
as well. Um,
Unsure about probiotics and if there's one which is best suited, or if probiotics should be avoided until gut issues and triggers are more stable.
as for avoiding them, I'm going to let Chloe talk about the ones that are best. She's the gastro dietitian. Um, I think it depends. It depends what you're trying to do, really, when you're going to introduce them. And I think the main thing is not to do everything at the same time. So if you're going to introduce probiotics, don't do it at the same time that you're starting a new exclusion, or you're introducing a new vitamin supplement or medication or something like that, because you really want to see, are they working for you or are they not? Because they're quite expensive. So there's no point being on them if they're not doing anything, if you're paying quite a lot of money for them as well. Yeah.
Yeah. So if someone came to me with like MCAS and gut issues, we would look at like what symptoms do you have, because probiotics are generally strain specific, so the type of bacterial strain in them will change what we use it for. So if you've got diarrhea, I might use a really different probiotic to if you're really constipated. Saying that, there is a specific strain called L. rhamnosus GG that is thought to have mast cell stabilizing effects. So I do, often use that, and there are several brands that do that with that strain. But I think it's really specific depending on symptoms, and some bacteria produce histamine and some can help us break it down, so it's important to choose the right one. And like Alison says, to try one at a time. I think you can have too much of a good thing. I've seen people on like 5 different probiotic supplements, and actually
So
probiotics are designed to complement each other. So if you're taking 5 different ones from 5 different brands, they haven't been all tested to work together. So they could almost be cancelling each other out. So actually you're better off just taking one and seeing how you get on. And usually we say try one for 12 weeks, and if there's no benefit, then stop and swap brands, because not every single brand or every single bacterial strain works for every different person.
yeah, and these are not tested on MCAS, are they? So that that's the thing. Nothing is it? That's the
No,
problem at the moment.
no, we
And
have no
yeah,
big trials that look at that.
yeah, exactly. So they're tested for if you like basic gastro stuff, but not MCAS.
Yeah.
But they are being tested for more and more things, aren't they now? So one day they'll catch up with us, I think. She
Yeah.
says.
All we have right now is transferring it from other conditions. So if you have other
Yeah,
diagnoses like IBS, or um, there's some evidence for other allergic conditions, so we can kind of transfer that over. But like you say, there's nothing for MCAS specifically.
no, no. Okay, so that's all the new questions, isn't it?
Yeah. Um,
Shall I start
so
with the first one of my list?
go for it.
Um, so regarding combining mast cell diet with therapeutic ketogenic diet, which I need to follow for brain and insulin resistance, any help, tips, or pointers on how to make this diet interesting and appealing, and where to turn for ideas? So my first thought there was, why a ketogenic diet? There are very few uses of therapeutic ketogenic diets that are evidence-based. And if it's for insulin resistance, so I did forget to say that in the NHS, I'm a diabetes dietitian, so that is my kind of area as well. I would not put someone on a ketogenic diet because it's very restrictive. And as we've said with the kind of vegan, vegetarian thing, when you've got a diet already that you want to follow or need to follow, and then you start adding more restrictions, you end up with a lot of restriction. So I would not be choosing a ketogenic diet. I would look at more modifying the carbohydrate rather than being as restrictive as ketogenic. And that's likely to be better for your gut health as well, which again we know impacts on mast cell reactions because we don't want to restrict too much. There isn't a mast cell diet, so that was my other thought. There is no one diet for mast cell. Again, there's lots of different diets that might help different people. There's lots of different things to look at, but there isn't a universal diet for mast cell. I wish there was. It would be so much easier, but there isn't. And also, any diet that you are doing around mast cell is generally based on reintroduction. So we would not be on a restrictive diet, and staying on a restrictive diet anyway would be reintroducing foods. So again, there's something there about trying not to get that restrictive. But if I was then trying to combine different diets and look for help, I would start with the one where there's the most information. So you can get thousands of recipes and meal plans for keto online. It's a very lucrative business. So if I was doing it, which I do not recommend, I would start with that and then superimpose what I was doing, whether it was histamine or something else with that. That would be my kind of way of doing it, I think. What do you reckon, Chloe?
Yeah, I think you're the expert in terms of ketogenic and blood sugar. So, but yeah, I think that makes sense. And my next one was, is there a connection between SIBO and MCAS? For anyone who isn't aware, SIBO is small intestinal bacterial overgrowth. So you want most of your gut bacteria to be in your large bowel. So SIBO is when that overgrows in the wrong place, which is the small intestine. And that can occur for a number of reasons. So one of the most common ones is sort of long-term use of something called proton pump inhibitors, which is used for acid reflux. So we don't have any evidence that SIBO and MCAS are linked, but it is something we see occurring. I don't think we totally understand why that is. For some people, it is because they've had lots of reflux and have ended up taking long-term PPIs. For some people, it's because they've got comorbidities like HEDS, where the speed at which the food moves through your gut may be changed. Again, we don't have loads of evidence that HEDS and SIBO, are definitely linked, but it's something again that we see. So we don't totally know, but can the SIBO improve if the MCAS becomes stabilized? I don't think that is being proven at all. And actually, the only evidence-based treatment we have is an antibiotic called rifaximin. And there are some evidence for the use of probiotics in SIBO, but I wouldn't just be waiting for the MCAS to stabilize and the SIBO to improve. You need to be under a gastroenterologist to give you appropriate help. Is there anything you'd add, Alison?
No, I agree. I think there probably is a role of gut motility, isn't there? As you say, with HEDS, and also maybe whatever's happening in the immune system as well. So if you've been on a lot of antibiotics or something like that, if you're more prone to infections and things, that could also be another kind of factor in there as well. But there isn't a particular diet either. I don't know if you've got that as another question, so I'll shut up.
There isn't
No.
another question. I think that's
Okay.
a really important thing to say, because I get so many people come and say, I need a SIBO diet, and there just isn't one.
No, the treatment for SIBO is antibiotics. I know that's weird because we just said antibiotics can cause SIBO, but specific antibiotic. That doesn't mean that obviously, just in the same way as keeping your gut healthy with everything else isn't worthwhile. Because, for instance, I would guess, but I'm not talking from evidence here, that if your transit is slow, then that might be more of an issue. So there might be a role for, I guess, for fibre and general dietary guidelines, but not a specific SIBO diet.
Yeah, someone's just said I've taken antimicrobials for SIBO, and I see a lot of people that have maybe seen nutritional therapists or nutritionists that don't necessarily have to follow evidence in giving like antimicrobial herbs or things that are described as that, and actually we have no evidence that they work. So even if you've taken those things, I think it's really important that you see a gastroenterologist and actually check the SIBO's gone away, because we just don't know that they work.
Yeah, yeah. My thing has always been, when you take anything, is it doing any harm? Um,
Mm.
and I always include kind of physical harm, psychological harm, and financial harm in that kind of weighing up of whether to try something or not. Um,
Yeah.
I'm doing that. Yeah. Um, do we know through which mechanisms MCAS can cause edema? So edema being swelling. So this question didn't specify what sort of edema. So they didn't specify whether it was kind of generalized edema, like ankle swelling and that type of thing, or angioedema, so the sort of swelling you get with allergic reactions, for instance. Um, so if it's generalized edema, like you've got a swollen belly, you've got swollen legs, that needs a medical review to check out really whether there's any heart or kidney or thyroid problems or any medication problems. So that would be my first thing. If it's angioedema, then we do know that the mast cell mediators can cause that. So what happens is the blood vessels kind of get leaky and you get fluid where it shouldn't be. So people often commonly get kind of swelling of the face, sometimes the lips, sometimes inside the mouth as well. Um, because the fluid's leaking into the layers of the tissues, it's not where it should be. Um, you can get a hereditary angioedema as well, which tends to be quite much more severe swelling usually, and that can be tested for. So, and I hardly dare say it, if you were to see someone in an allergy clinic, you would probably get that tested for. I know how difficult it is to get to an allergy clinic on the NHS these days, so I kind of say that with a little bit of. Um, but yeah, if you're getting the severe swelling, that needs looking at really, um, because it might not be safe.
So my next one is, can MCAS cause gut dysbiosis? So that is a change of gut bacteria away from the normal, and I say that in inverted commas because all of us have different normals. Like, it's as different as our fingerprints, and you won't have the same gut bacteria as anyone in your family, or anyone close to you. Um, Again, we have no evidence that MCAS can directly cause it. However, I think there probably is a role in how our gut health, feeds into MCAS. Like 70% of our immune system is in our gut. So you have mast cells all over your gut. So I do think there probably is a relationship there. Um, I think also there are different things that can cause gut dysbiosis. It's the things like stress, change in diet. Um, so MCAS is obviously an extremely stressful condition. Um, so that is going to affect your gut health and potentially cause dysbiosis. Um, Diets can often become really restrictive, and reducing things like plant-based foods, which reduce your fiber, can have a massive impact on your gut bacteria. Um, so I do think there probably is a correlation. We just
Mm.
don't really have any research on it.
Yeah, and which way round? It's a chicken and egg one, isn't it? Again,
Yeah,
is the gut causing the MCAS, or is the MCAS causing the gut issues, or probably a bit of both in reality as
yeah,
well.
definitely.
Yeah. So my next one is, do we know through which mechanisms MCAS can cause weight gain without a significant change in diet? No, we don't have any clear evidence as to why some people gain weight. We do know it happens in gastroparesis as well, and it's probably to do with motility somewhere along the lines and just subtle changes in energy intake and expenditure. There's actually quite small differences can make a difference to weight. We don't know what's happening sort of metabolically either for people, and then there's obviously medications into that mix. But definitely making sure that things like your thyroid function, for instance, have been checked to make sure there's not something else going on with that. Don't know if you've got any other thoughts on that, Chloe, because that's a difficult one, isn't it? People are often really upset when they've got gastroparesis and they're gaining weight, because I think they get quite a lot of disbelief as well um, from different people.
yeah. I don't think we fully understand it either. Yeah, so it can be difficult.
Yeah.
My next one, is there currently any reliable way of testing the gut microbiome? No. So there's loads of really expensive gut microbiome tests, and I feel really awful when people have spent a load of money on it and bring it to me for interpretation, because I think we can assess your gut health based on your lifestyle and your diet without paying for these really, really expensive tests. We don't really know what a perfect gut bacteria looks like. We know what we want more of, what we want less of. But as I said, every single person's is different. So your optimal, your, great gut bacteria is going to be really different to my great gut bacteria. Um, and there are companies that give you dietary recommendations based on these stool tests, but it's almost jumped the science of it. It's gone a bit faster than we really have the evidence for. So I wouldn't, it's not something I promote, gut microbiome testing.
No,
Have you?
yeah, I agree. Same reason, really. We don't know. We don't know what optimal is.
Yeah,
And it
yeah.
might be different for different health conditions as well. We don't know that. Yeah. Yeah.
There's so much we don't know, isn't there?
I think it's also likely you're also only testing it in that specific moment in time. 10 minutes later, it might be different. 2 hours later, it probably is different. It's going to vary so much. Um,
And there is evidence that there can be like seasonal differences as well, depending on what we're eating. And, if you've taken antibiotics in the last 3 months, and, so many other things that are going to affect it, like you say.
yeah, makes sense, doesn't it, when you think about it? Um, so there's another one here about this one's about blood pressure. So do we know which mechanisms MCAS can increase blood pressure without significant change in diet? So a bit like the one on edema, I'd be just checking out non-MCAS causes first if you've got high blood pressure, family history, some metabolic syndrome, diabetes, things like that. What else might cause it? Um, and also things like POTS or different varieties of POTS, like hyperadrenergic POTS, where you can get high blood pressure rather than low blood pressure. Um, but some people do seem to have quite variable blood pressure with MCAS as well, where it's all over the place. And again, that's likely to be the mast cell mediators playing their tricks there, because if they can kind of, they can cause constriction and dilation of blood vessels, that's going to change what happens with your blood pressure as well. Um, and there's probably not very much diet-wise you can do about that. I mean, general advice for blood pressure is around managing weight, managing salt intake, and more of a Mediterranean type diet. You're not going to be cutting right back on your salt if you've got POTS potentially. So there's a little bit of a mix up there. But yeah, I think a medical review first, to make sure you've not got persistently high blood pressure. And then it's all the same things that we're normally doing for MCAS, really, and managing that, I think.
Yeah, I agree with all of that. My next one is, can MCAS cause or contribute to severe distension and bloating? And a bit like Alison said with that blood pressure one, I don't think we should just say, oh yes, that severe distension and bloating is definitely due to MCAS. I think it's really important. Other things are still ruled out. So things like celiac disease, inflammatory bowel disease. So you can get your GP to do a blood test for celiac disease in primary care, or and you can also get them to do a stool test for inflammatory bowel disease called fecal calprotectin. But because there can be so many comorbidities which involve the gastric tract with MCAS, I think it's really important that, even if these things come back clear and you just think something's not right, that you push for a referral to a gastroenterologist, because there can be things like gastroparesis and SIBO, and lots of other things. Um, it can be IBS, that can occur with MCAS as well, but I think it's really important that sort of red flags are ruled out, especially if you've got any other symptoms such as, rapid weight loss, blood in your stools, vomiting a lot. So don't just, think it's just MCAS.
I think that's going to be the message of today, isn't it? Um, I know health professionals do it as well, don't they? To patients as well, is just assume
Yeah.
everything's the same diagnosis you've got, but sometimes it isn't. And as we all know, you can collect other diagnoses when you've got things like MCAS and EDS and POTS as
Mm,
well. Um,
yeah.
Not a collection we want, though, is it? Particularly, but it's the nature of it. Um, I've heard that you shouldn't take quercetin if you're taking a statin. Is that true? Um, Quercetin can interact with statins, so that's one to talk to your doctor or the pharmacist about. Definitely, if you're starting on a statin, which is to lower your cholesterol, because potentially it can create reduced levels of the statin, so it might not work as effectively. Um, so definitely check that out. And I think that's something I'd give as a message for all supplements. Actually, if you're starting on medications and you're on supplements, discuss them either with the doctor, who may or may not know, but definitely with the pharmacist, as to whether there's an interaction between your supplements and the medications. And the same goes for if you're getting blood tests as well, because some supplements can affect blood tests. So, for instance, if you're on biotin, it can affect thyroid function tests. So, it's worth mentioning these things. If you are on a lot of supplements, it can also affect warfarin as well, but less people tend to be on the blood thinner warfarin now. They tend to be on newer varieties of that. Yeah. So in the olden days, we used to have this like drugs line that we could ring and find out, like if any supplement, we could just ring up and find out what it reacted to, but I've got that anymore.
Pretty sure quercetin can interact with citalopram as well because they both increase bleeding risk, and there's a few like that. So, um, yeah, it's important that you don't, if you are on a lot of other drugs to make sure you're getting the right advice.
Yeah.
Um, so why does MCAS cause diarrhea and abdominal pain? So again, get all of the things checked out, but there are mast cells all over your body. So they're all over your gut as well. And the chemicals, so the mast cell mediators that are released by those mast cells can cause things to happen in your gut and cause symptoms is probably the easiest way I can explain it. But they can affect every single organ of your body. So the next question I have is, what's the connection between mast cell and your bladder? And it's really the same, you know, um, mechanism. Histamine can increase the sensitivity of nerves to the bladder, and histamine is one of those mast cell mediators that is released by your mast cells. So, um, unfortunately, it does affect many different body parts.
Yeah. Everywhere, isn't it, really?
Yeah.
That's the problem. Um, Quick one then here. How to check copper levels? Um, with a blood test is the answer. But with the kind of slight proviso that it would be really unusual I'd be wondering why someone's checking copper levels. And also it would be really unusual to be deficient in copper and not other trace elements as well. So I don't know what you think about that. I can't think of anyone I've ever had tested for copper um,
Never
in,
tested anyone
in
for copper.
30 years.
No.
Because
I
I think I'd be looking if someone had some sort of malabsorption or something like that, that there'd be other things probably that would come up in the standard blood testing that would give a clue to the overall nutritional picture without having to get that specific. I think that's what would be my thinking.
Yeah. And yeah, copper can be involved in histamine breakdown, but like you say, if you become deficient in copper, you're probably malnourished anyway.
Yeah, yeah,
So we'd be working on that anyway, potentially with a broad spectrum multivitamin and other nutritional ways to build up someone's diet.
yeah, yeah,
So can foods provoke the release of mediators other than histamine? Yeah. So your mast cells are producing loads of other chemicals, not just histamine, when they're, exposed to one of your triggers, and that might be other foods. So yes, they can produce other things apart from histamine with food triggers.
yeah. Well, this is a big one. So fatigue is so bad for me. I'm already prescribed folic acid and vitamin D. Can I take anything else that can help? I'm getting numb feelings in my legs and I'm overwhelmed with exhaustion. I'm going gluten-free to see if that helps. So my first thought is further dietary restriction is not usually where we'd be going with fatigue, because one of the biggest things we see is malnutrition causing fatigue. So, we want to try not to restrict if possible. And actually, the only reason we'd be going gluten free is if that fatigue was due to celiac disease. So, I would be asking first, have you seen the doctor? I guess this person probably has, because most people I see will have seen a doctor at some point and had some basic bloods. But just in case, I'd want the screening for celiac and what's called a fatigue blood screen that looks at things like different sources of anemia and that type of thing, and diabetes as well. I have to put that in, just in case something's been missed, because sometimes simple things are missed sometimes when we're looking at complicated things. And then I'd be looking, is the diet adequate? Has it got adequate energy? That's one thing. Has it got adequate fluid? Because low fluid intake is another cause of fatigue. Are you allowing your body to have rest? Because it's actually, rest is really productive, but also some of it is quite difficult to take as well. I know our lifestyles don't always allow it, or also it's not always a choice. The numb legs bother me. And that's why I'd want the sort of screening bloods at the GP really for things like thyroid and B12 and things like that, just to check there's not another reason why that's happening as well.
I'd be really wanting to check ferritin, so that is your iron stores, and I'd want to find out the number because our guidance has just changed. So, and a lot of surgeries haven't caught up with it yet. So, a lot of surgeries are still using 14 as a cutoff to diagnose low ferritin, whereas most recent research shows that anything under 30 is iron deficiency and should be treated as that. So someone's just popped up and said theirs is 20. That is iron deficiency, especially if it's accompanied by symptoms such as fatigue. Restless legs can be a symptom of iron deficiency, and we really need to be treating that. But a lot of people are being told that 20 is normal. It is not. It needs to be treated, and that is such a massive cause of fatigue. I've seen so many MCAS patients and long COVID patients that they've been told it's normal, and it's absolutely not.
No, and there is some evidence, isn't there? There is some evidence in POTS anyway that ferritin levels can be lower in people with POTS. We don't entirely know the reason for that. But yeah, I mean, I've seen someone this week with a ferritin of 8. That's obviously way too low, and that they were feeling that. But there's also some suggestion that levels higher than 30 are much better, more like 100 in terms of MCAS. So some of the research from the States suggests, aiming for a ferritin of 100 or above if you've got MCAS. So that's very different to the NHS guidelines. And I think that's why it's always worth being able to see the blood test results. So I'll often get people come and say, I haven't bought my results because my GP says they're fine. And I'm like, can you get the numbers for me, please? So I can see what the numbers are, because fine or within guidelines isn't always the same as optimal. They're just slightly different.
Yeah, I totally agree. And the amount that you need is going to be really different to the amount someone else needs. Like there was a study on POTS that showed that people have more POTS symptoms under 50 ferritin rather than over 50. But if yours is 55, but you still have symptoms that aren't your normal, then I think it's still worth maybe optimizing the iron and going on symptoms and how you feel.
Yeah. The other thing is iron supplements tend to be quite rough, don't they, on people? So they're quite difficult for people often to take. So there is some kind of newer guidance around that, showing that taking them on alternate days can be helpful as well for the absorption of the prescribed supplements. So that's certainly something to have a word again with probably with the pharmacist. Actually, it's easier to access them, I think, than most GPs, and say, is that something you could do if if you're struggling with the gastro effects of supplements as well.
Yeah. And And mine was, can any fermented foods be tolerated in MCAS? Again, really, really individual. So some people can be fine with some fermented foods. Yes, they are high in histamines, but everyone's tolerance to histamine is going to be really different. And you may have heard me talk before, or Alison talk before, about the bucket theory. So different things are going to fill your bucket up with histamine at different rates. So if your bucket is full 3/4 to the top from stress, and then a little bit more is filled by, I don't know, a reaction to pollen, then it's going to leave a tiny bit of histamine from food before your bucket overflows and you get symptoms. Whereas if you're relaxed, you weren't exposed to pollen, your bucket from that is going to be much lower. So you might be able to tolerate more things like fermented foods. So your tolerance to fermented foods might differ on different days, different seasons. And the only way you are going to know that is by testing it at different times, trying small amounts and building up.
So I'm having a very restricted diet, but recently it seems like whatever I eat, my stomach hurts. Any advice, please? Um, I suppose I'd be worried about the very restrictive diet, and how that's come about, and what how restricted is restricted. Um, very sounds very. So that worries me a little bit. Because we do tend to see that if people are on very restricted diets, then they seem to then find that each and every food starts reacting, and it becomes like a downward spiral of restriction and then malnutrition as well. And some of that's probably to do with the effects on the gut, of having such a restricted diet, and possibly on vitamin status as well. If it's so restricted that you're malnourished, then you need medical support, partly because increasing your food might be risky, but also because, what's causing that? Is that the MCAS, or is there anything else going on that's causing that level of pain that's restricting your eating? If it's all foods, I would also be wondering if it is food or if it's something else as well. Is it something environmental, perhaps? That it's not actually food at all. Um, what's happening with your gut generally? What type of symptoms are you getting? So I always tend to look at that because that sometimes gives me a clue as to what's going on. It's really hard because the only answer is to increase food, isn't it? And that's going to take a lot of um, strength, and it's really difficult to do when you're in pain, I think. Really, really difficult. There's quite a bit we can do to support people with that. I think that's the positive side of it. But the key really is to try not to get there in the first place, I think. I know you've had a few people, haven't you, Chloe?
Yeah, yeah, I've had quite a few. And but I also wonder in terms of pain, like food fear is massive, isn't it? Like we see it all of the time, and I can totally understand why. It's just a horrible place to be.
Yeah,
Um,
awful.
but there's such a massive link between our gut and our brain. If we're fearing food before it even goes in our gut is going to be as stressed as we are. Um, I've even suggested to people doing something like, if music relaxes you, putting headphones on during a meal and listening to music, or doing anything that kind of can calm your system enough to relax and enjoy that food. Distraction, meditation before meals, anything that can kind of calm that gut brain connection to tolerate it enough, because I think we all underestimate how massive that link is. And I don't mean it's in your head at all. It's absolutely not. But if you're stressed, your gut is too.
Yeah, and it is stressful, isn't it? When you have symptoms from food or symptoms from other things, it's incredibly stressful, incredibly difficult. And I think there's something along the line around tolerating certain symptoms as well. But once you get to that level of pain, that's a big
Mm.
deal, isn't it?
Yeah.
Um, because gut pain is really not nice at all.
No, it's hard to put up with, isn't it?
Very hard, yeah. Shouldn't have to, should you really?
No, absolutely not. So if a patient can access medications in the hope of becoming stabilized, can it subsequently be a goal to reintroduce some medium histamine healthy foods? Yeah, absolutely. For a lot of people, they can reintroduce foods, and that should be the goal in most cases. Um, Obviously, there's always extreme cases where that's really, really tough. And for some people, medications aren't even their way to reintroduce foods. There might be other options to help manage MCAS without it, because for some people, medications, aren't tolerated for whatever reason. But yeah, some people can absolutely reintroduce some medium histamine healthy foods. That doesn't mean, all times a year, all situations you will be able to tolerate them. So, my husband, for example, when he's relaxed and it's not pollen season, can eat quite a wide range of histamine containing foods. But when he's super stressed or he's just had an infection like COVID, or he does have to go back to, a stricter low histamine diet. And there's no set time period for that. But I think what is important is you always try and reintroduce after those periods.
Yeah. Yeah. We've just got tomatoes back. That's our celebration in this house. Tomatoes. I can cook with tomatoes again, and I am so happy. I can't even tell you. And my daughter, who has MCAS, says that tomatoes taste amazing because she hasn't had them for like 6 years.
Wow. I bet that's
So
amazing for
yeah,
her.
that's our win this month. That's not to say it won't be taken away at some point, but we're with it at the moment. I just
Yeah.
wonder if we should look at the questions in the chat.
Yeah.
As time's cracking on a little bit.
Okay, so the first question, any advice for vegan ladies and pregnancy with MCAS, please? We're pre-conception now. Any tips for breastfeeding too?
I think in that situation, it's really, really important to get individualized advice, because actually, you've got a vegan diet and MCAS and pregnancy. I think it's really, really important that you are given specific dietary advice for that situation.
Yeah, no, I agree. You need a proper clinical assessment really to make sure that you're getting the right nutrition, and also because not all supplements are safe in pregnancy as well. So all medications for that matter. So someone really needs to check that out for you and make sure you're on the right things that's safe. Yeah.
Fab. I have severe bile acid malabsorption as well. Can you recommend anything to help the gut that's low histamine?
So bile acid malabsorption, the only treatment for that is a specific type of medication or a low fat diet. Obviously, I don't know, your medical history and what treatment's suitable for you. And I don't think there's anything that's going to help your gut to make that bile acid malabsorption better. So I would take the advice from your gastroenterologist in terms of the appropriate treatment for that.
Yeah.
In the last session, you mentioned there was a new BDA histamine information sheet due out. Do you have any idea when this will be available?
No, it's gone off to be approved. Yeah, it's like finalized, but we're just waiting for its approval. We are allowed to use it with our own clients, but it's not published for general use yet.
Do you think MCAS gastro issues are due to vagus nerve malfunction or mainly due to gut bacteria?
I would argue mainly got, well, possibly not either or a bit of both. But I think mostly gut bacteria, I'd think, but also, the actual mast cell mediators themselves, because, they can cause gastro issues, just like an allergy to foods can cause gastro issues. So again, it's that fluid again, isn't it? If you've got a gush of fluid into the gut, you could end up with diarrhea, bloating, those type of symptoms. You can end up with swelling in the gut again because of mast cell mediators. So I don't think it's as simple, but I guess I don't know a lot about the vagus nerve, but I guess it ties into, I think of it more like the gut brain axis rather than thinking of the vagus nerve as one thing. So more of, it's that gut brain connection again. So I guess the same things that help one will help the other. So again, goes back to that relaxation and being able to sort of turn off your brain, if you like, which I'm hopeless at personally, but so I don't think I should be commenting too much on that. I don't know what you
You should
think,
come to
Chloe.
our mindfulness sessions, Alison. Come along and
I
try our
can't do
mindfulness.
mindfulness. I don't have a mindfulness brain, I'm afraid. I crochet, that's what I do. That's my mindfulness.
Oh.
Um,
Um,
so yeah,
oh, sorry,
I
Chloe,
think
go on.
what Alison said is right. Like, but I think of the nervous system as a whole rather than the vagus
Mm.
nerve. So if you're in constant fight or flight because you're stressed or reacting to things constantly, then you're not able to rest and digest as well as you could. So things like meditation can be really helpful for some of us. I'm a massive fan. I've started doing it. I've got my 50-day award now, and it's been really helpful for my gastric symptoms as well. So like there's stuff like the insight timer which I use, which is really helpful. Things like headspace. So that can be really helpful to relax that. But I think it's a bit of a combination of everything: mediators, gut bacteria, nervous system. Yeah, lots of
Yeah.
different reasons.
Chloe, you've just given me an idea for a new session. We could do a rest and digest session. Wouldn't that be nice if we did it after dinner and we could all just relax and let our food digest? Um, what what do histamine liberators do to the brain?
I think we kind of explained that it's not really a thing, or not a thing that has much evidence for.
Also, probably not our area of expertise, really. Um, but
There aren't
yeah,
any human
the
studies into histamine liberators. That's the problem. They're all in the lab
yeah.
in test tubes. So we don't know that histamine liberators have any effect on any part of us at the moment.
How do I tell which symptoms are due to intolerances and which are not? It's often hard to know. That's a common question that we have because you can obviously react to foods or you can not tolerate. It's not always black and white, is it?
No.
Yeah, I think food diary and seeing if there's a pattern. So just because you have symptoms after a food at one time doesn't mean that that is, necessarily going to happen every time. So I often get people to do like food and symptom diaries, but not just write down, the food, but write down what else has happened that day. Have you been exposed to those perfumes, or has it been like a super busy or stressful day? Other things that aren't just food. Um, Menstrual cycles play a massive role as well for females.
Yeah, pollen allergy, other allergies as well. I was going to give an example of that. Another personal example from our household was, we were trying to work out why my daughter looked like a puffer fish after some meals recently. Because she gets the sort of cheek swelling. Um, and eventually, after thinking about all the foods, we pinned it down to the room temperature. And actually, if it gets too cold, if her face gets too cold, it swells up. So it wasn't actually to do with the food for her, it was the temperature, room temperature, that was the issue.
Mm.
And it just took time and thinking through each thing and what was the common denominator that was setting it off. So now she needs a balaclava.
It is that simple that sometimes it's a fragrance or something else that's happening, the temperature, the weather, and also I've seen my daughter use hand soap and have diarrhea as a result. So those diaries are so important, aren't they, to try and help us track what's going on. I've popped our symptom log that we developed in the chat. There's a whole page all about tracking symptoms, and there's logs and kind of guides that help you work through. So if you've not had a look at those, they may be helpful. I've just realised I've had some extra questions that I missed a little bit further up, which came in the private message. So I'm not sure if this is, I've not read it, so excuse me as I go through because it's quite long. With regards to related conditions, common comorbidities to MCAS, I know about POTS and HEDS. Do you see many patients with inflammatory arthritis, long COVID alongside bronchiectasis? If
Yeah,
so, do you think MCAS plays a role in these conditions, and are they affected by diet and medication?
long COVID, definitely. And we know there's probably a link with autoimmune conditions. So some types of arthritis are autoimmune as well. So there seems to be kind of a link between the autoimmune conditions, MCAS, POTS, EDS, and long COVID kind of comes in that picture as well. Is there a dietary role for some of the things, but not all of them? I think that'd be the answer. I don't know. You see
Um,
more long COVID patients than me, don't you, Chloe?
Yeah, I see quite a lot of lung COVID patients, so I definitely see the overlap there. I think probably the answer is just we don't have any big studies that look at all these connections, but I think it probably does play a role in a lot of other things. Like there are consistent patterns I see across patients, but it would just be speculation, and we just need loads more research in this area.
Yeah.
We do. And just in autoimmune conditions, don't we, generally? Because although MCAS isn't a condition as such, we don't know whether we suspect that POTS might be, for instance, but we don't have that evidence yet. So more research,
Yeah,
more
we need
research, more
lots
research.
more
I thought I saw
research.
something pop up when we are talking, saying why isn't there more research in this area? And I think you could probably say that about an awful lot of conditions, to be honest. But it's a relatively newly defined condition. And certainly, as most of you'll know, in the UK, it's not very well known still. Until things are well known, they don't tend to get the research funding. So it's a little bit of a kind of chicken and egg type of thing again. You need to get better known to get the research funding, but yeah, difficult, isn't it?
What is the relationship between gastroparesis and MCAS, and why are they interconnected?
The people I've seen, it's because they've got EDS. So that's where the connection is for the people I've seen. Obviously, I see people with gastroparesis with diabetes as well in my other job, but not so much MCAS on its own.
I have also seen people with like long COVID gastroparesis POTS that have potentially developed it as a result of that. But again, I don't think that HEDS is always diagnosed in a lot of people. So I can't tell you whether those patients actually have that or not. So yeah, I think the patients I do see it is often as a result of HEDS rather than the MCAS part. But obviously there are exceptions to that rule.
Yeah, I think that's certainly what I've seen as well.
Can you speak on MCAS and alpha-gal at all?
No,
So
only in them.
alpha
I see them as something completely separate.
yeah.
Yeah.
I guess if the MCAS is a result of Lyme's, and alpha gal might be as a result of that. So, but
Actually,
it's not a common thing that I see.
I don't think it's a very common thing in the UK, is it? I think it's probably getting more common, but it isn't common now. I don't think I've had any patients with alpha gal. Um, yeah, so
It's
it might
not
be common
something
trigger.
it's not something that commonly crops up in
No,
conversations that I'm
no.
having.
But I'm guessing also it could be underdiagnosed because people don't know about it. So there's always that, isn't there? As well.
Yeah.
Yeah.
How do you make sure a diet is balanced? I'm not sure many healthy people have a balanced diet, even though they might not have any dietary restrictions.
After 30 years of assessing diets, I have to agree. Um, how do you make sure you've got a balanced diet? You're right. I mean, I work primarily with teenagers in the NHS as well, so I don't see that many balanced diets in that group either. Um, I think you're right that most people don't have a balanced diet, but if you're having enough variety of food, things tend to even themselves out. I think that's the important thing. So if you're having, eating a decent variety of different foods, you are going to get a balance of protein, carbohydrates, fruit and vegetables, whole grains, and the things that you need. It's really when your diet becomes very restricted that you have to start to think more consciously about the balance of your diet. So I think for the most of us, providing you eat a reasonable variety of food, ultimately you'll get enough of everything. But once you start restricting, we have to be a bit more careful about it, I think.